So good morning student. Today we are going to discuss advantage and disadvantage of suspension. This is my second lecture, second video on suspension or biophasic liquid dosage form. Firstly we are going to discuss advantages of suspension. Suspension in stability, in the concern with stability, suspension can improve the chemical stability of insoluble drug. जे insoluble drug आहे त्यांची chemical stability जी आहे you can use while formulating the suspension. Example is procaine penicillin G. It has increased the instability while the formulation of your suspension. Then choice of solvent. If drug is insoluble in water and solvent other than water are not acceptable, suspension is the only choice. For example, corticosteroid. असे ड्रग की जे की वॉटर इनसॉल्युबल आहे ते ड्रगचं तुम्ही ऍज अ सस्पेन्शन म्हणून फॉर्म्युलेशन करू शकतो. सस्पेन्शन म्हणजे नथिंग बट अनडिझॉल्व टायनी पार्टिकल इन युअर vehicle or in your liquid phase. Prolonged action. Suspension has a sustained effect because before absorption solid particles should be dissolved which take some time. But as you know that there is a suspension containing a small amount of particle that has a required solid particle that has a required time to absorb or dissolve to show its prolonged action, and that's why it has produced the prolonged action which has the more time action. Prota means zinc insulin suspension. This is the example of the prolonged action. त्यानंतर आहे mask the taste. Suspension can mask the taste of drug. Example, insoluble chloramphenicol palmitate is used which does not have the bitter taste. When you are using the chloramphenicol maleate as a soluble form, it has a bitter taste. When you are using the salt form or insoluble chloramphenicol salt, it has a no taste. You can easy to formulate in the formulation of suspension. Palatability and convenience. Insoluble drug may have the more palatable. Suspended insoluble powder are easy to swallow. Whereas when we are formulating as a suspension, insoluble particles are easy more palatable and has a property easy to swallow आणि ते swallow पण easy होतात. Suspended solid may slowly separate on standing but be easy to redisperse. Whereas suspended solid has a property to slowly separate on standing but they are easily get redispersed. Redisperse पण लवकर होतात. त्यानंतर आहे bioavailability. Drugs in suspension exhibit the higher bioavailability compared to the other dosage form due to the large surface area, higher dissolution rate. Because of drug containing the smaller particle size and smaller particle size has the larger surface area has a higher dissolution rate. Higher dissolution rate should be the higher bioavailability. Bioavailability means the availability of drug at the site of action. जिथं तुमची site of action आहे तिथं जो ड्रग अवेलेबल असतो फॉर द शो द इट्स फार्माकोलॉजिकल ऍक्शन त्याला म्हणतात बायोअबिलिटी. Example, antiacid suspension have more action than the tablet. In the comparison of the tablet formulation, antiacid suspension have more action than the tablet formulation. त्यानंतर बघूया आपण disadvantage of suspension. Physical stability, sedimentation and compaction can cause a problem. When we are formulating the suspension, there is a settling down of particle. It's a major issue with your suspension. Settling down of sedimentation is a major issue for the settling of the particle. It is difficult to redisperse from the settling particles. Compaction can be cause a problem. When we are preparing the solution in that time, suspension, in that time, compaction is required. You are applying the force. Because of force, there is a physical instability, the chances of your suspension. Susceptible to the degradation and possibility of chemical reaction between the ingredient in solution where water is a catalyst. आता when we are preparing the suspension, in that case there is a most chances of degradation because of water as a catalyst, and water as a catalyst which has a property of water, it has a oxidation reduction reaction will be take place and there is a degradation of your ingredient and water. Uniform and accurate dose does not achieve unless suspension are packed in unit dosage form. आता when we are preparing the 100 ml solution, it has a required shaking and this appropriate dose should be achieved, appropriate dose should be achieved because of settling of particles, viscosity of your liquid that may be affected. If you are preparing the unit dosage form, that is the 5 ml, 10 ml dosage form, that can be achieve the very good suspension. Suspension are difficult to formulate. In the comparison with your preparation of, suppose you have to preparing the solution, it requires the more time, it requires the less time, and it is easy to dissolve or easy to formulate as compared to your suspension. Where you are in the preparation of suspension, you must have to maintain the viscosity, you have to maintain the sedimentation rate, sedimentation value. This parameter you have to maintain. That is the difficult to the formulation. Preparation requires shaking before use. आता जे preparation बनवलं, it has required the shaking each and every when you are administered the each and every dose. It is mandatory to shake the preparation because settling of particle will be there. Storage condition can affect the dispersed system. This is storage condition also affect. If increase the temperature, viscosity decreases. Viscosity decreases, sedimentation increases. Therefore, the storage condition may be affecting your suspension. These are the disadvantages of suspension. Then classification of suspension. We are discussing the classification of suspension. Suspension are classified in the first class based on therapeutic class. Antacid suspension, example magalidate, and symmetric one oral suspension, which reduce the acidity. Antibacterial suspension, example is ciprofloxacin oral suspension, which kill the bacteria. Analgesic suspension, example paracetamol suspension, analgesic is kill the pain. Anthelmintic सस्पेन्शन, अल्बेंडाझोल ओरल सस्पेन्शन, जे की जण तुमचे मारण्यासाठी करते किंवा वर्म इन्फेक्शन आहे त्यासाठी कंट्रोल करण्यासाठी यूज होते. अँटी कन्व्हर्जन सस्पेन्शन, एक्झाम्पल इज फिनाटोइन ओरल सस्पेन्शन. अँटी कन्व्हर्जन मीन्स टू इपिलेप्सी, इट इज कॉल्ड एज टू ट्रीट द इपिलेप्सी और जी फिट किंवा मिरगी म्हणतो ते कंट्रोल करण्यासाठी जे सस्पेन्शन फॉर्म्युलेट होतो त्याला म्हणतात अँटी कन्व्हर्जन सस्पेन्शन. त्यानंतर बघूया एक्झाम्पल फिनाटोइन ओरल सस्पेन्शन, अँटीफंगल सस्पेन्शन, एक्झाम्पल पोसोकोनाझोल ओरल सस्पेन्शन. दिस इज द ट्रीटमेंट फॉर द फंगल इन्फेक्शन. ड्राय अँटीबायोटिक पावडर फॉर ओरल सस्पेन्शन, एक्झाम्पल इज अजिथ्रोमायसिन ओरल सस्पेन्शन. दिस इज अ ड्राय फॉर्म्युलेशन ऑफ पावडर फॉर द रिकॉन्स्टिट्यूशन. This is called as a dry antibiotic powder for oral suspension. Example is azithromycin oral suspension. Anti-cancer suspension for intravenous injection. Example is paclitaxel for intravenous. This is treatment for the cancer patient. You can be formulate the suspension injection for the treatment of cancer. Example is paclitaxel for intravenous. Contraceptive suspension for the intramuscular injection. Example is medroxyprogesterone acetate suspension. These are it as a contraceptive means birth control साठी ज्या टॅबलेट किंवा सस्पेन्शन बनवतो त्याला म्हणतात कॉन्ट्रासेप्टिव्ह सस्पेन्शन. Then antidiarrheal suspension for intramuscular injection. Example is amoxicillin suspension. This is to treat the diarrhea. Topical lotion for various skin condition. Example is hydrocortisone topical suspension for the apply over the skin. त्याला म्हणतात topical lotion. Based on particle size, according to the particle size present of according to particle size of your solid particle, that can be classified. Nano suspension, it has a 10 to 100 nanometer in diameter of your solid particle. Example celecoxib suspension. Colloidal suspension, it contains 1 nanometer to 0.5 millimeter diameter of your solid particle. Example is acacia suspension. Core suspension, more than 0.5 millimeter in diameter of your particle size. Example is calamine lotion. Then based on particle size, diluted suspension, solid contain 2 to 10%. Example is carticosone acetone suspension. Diluted suspension, it contains 2 to 10% of solid particle. Where concentrated suspension, solid contain 10 to 50%. Example zinc oxide suspension in external use. This is the concentrated, it has a more amount of solid present in the suspension in the liquid. Based on nature of behavior of solid, foculated suspension, example ciprofloxacin acetate for the oral suspension. ठीक है, foculated suspension is a suspension that have the solid particle are loosely aggregated to form a network like structure. त्याला म्हणतात foculated structure, foculated suspension, or it form a For defoculinated suspension, examples are the paracetamol oral suspension. Defoculinated suspension म्हणजे it has a particle size or your drug particle has a individual entity. They are individually entity. This called as a defoculinated suspension. Then base of route administration. Oral suspension, for example, calcium oxytetracycline hydrochloride suspension. Topical suspension, example आहे calamine suspension. Parental suspension, जे की इंट्रामस्क्युलर इंट्राआयव्ही यूज होतात त्याला म्हणतात पॅरेंटल सस्पेन्शन. एक्झाम्पल डिझॉक्सी कार्टिकोस्टेरॉइड पायवालेट सस्पेन्शन. ऑप्थॅल्मिक सस्पेन्शन, एक्झाम्पल सिप्रोफ्लॉक्सासिन अँड डेक्सामेथासोन आय ड्रॉप. इनहेलेशन सस्पेन्शन, एक्झाम्पल बुडेसोनाइड सस्पेन्शन फॉर द इनहेलेशन थेरपी. Mode of dispensing. Extraporonous suspension. Example is rifampicin suspension for intravenous infusion. Reconstituted suspension. Example is tetracycline suspension. ठीक है. These are the classification of your suspension. Classification of your suspension.